You are now about to start viewing the second PowerPoint for the third class in M174. When women are trying to get pregnant every month, they are looking for signs and symptoms that they are pregnant. For the woman who does not want to be pregnant, she's trying to explain why she is having certain symptoms onto some other reason or cause. The presumptive signs of pregnancy are just that. They are signs and symptoms that the woman can presume she may be pregnant, but not be absolutely certain because they can be caused by other things. Amenorrhea, nausea and vomiting, breast changes, skin changes, and vaginal discharge are all caused by hormonal changes during pregnancy. Fatigue to the point of needing a nap during the day is a common complaint during the first trimester of pregnancy. Women should be encouraged to listen to their bodies and rest periodically during the day, preferably with their legs raised. The weight change in the first trimester is only a few pounds and can be explained away by an increased appetite. Because the bladder can have urinary stasis, the woman should empty her bladder more frequently and not limit her fluids during the daytime hours. The nurse should also encourage the woman to wear a well-supporting bra and to reassure her that the skin changes and vaginal discharge are normal and will go away or fade after the pregnancy. Probable signs of pregnancy mean if you have them, you are probably pregnant, and they are less likely to be explained away by other causes. The woman may notice that her abdomen is getting larger. She may actually be able to feel the hard uterus rising up above the symphysis pubis. As this happens, the waistline also disappears. The healthcare provider assesses the cervix and uterus for the Chadwick, Goodall, Hagar, and McDonald's sign that we talked about in the previous PowerPoint presentation. The examiner will also be able to ballot the uterus. This means that when tapping on the cervix through the vagina, the fetus will move up to the fundus and then fall back down toward the cervix. This can be felt by the examiner. In the second trimester, the woman will start having irregular painless contractions. It feels like the uterus is tightening up. A positive pregnancy test is also a probable sign. However, there are false positives and negatives. Pregnancy tests are now able to detect the pregnancy even before the first missed period. The positive signs of pregnancy include the healthcare provider hearing the fetal heart tones and feeling the fetal movement and visualization of the fetus on the ultrasound. Ideally, a woman should be seen prior to conceiving to identify risk factors and to start on prenatal vitamins and folic acid. During the first antepartum visit, the woman receives a complete history and physical, labs are drawn, risk factors identified, and based on them, the plan of care is developed. This is also a time for the woman to ask questions and for the nurse to start the patient teaching. The nurse should anticipate her teaching needs based on the trimester of the pregnancy. In an uncomplicated pregnancy, women are seen every 4 weeks until about 28 weeks. From 29 to 36 weeks, she is seen every 2 to 3 weeks, and from 37 to 40 weeks, she is seen weekly. If a woman goes past her EDC, she is usually seen twice a week, either by her healthcare provider or in fetal diagnostics. Due to an aging placenta, the fetus is at risk for complications and needs closer monitoring at this time. After the first prenatal visit, these are the assessments that are made at every visit. We want to make sure the uterus is growing properly, so we measure it from the symphysis pubis to the fundus. The gestational age should equal the fundal height plus or minus 2 centimeters. For example, If she's 28 weeks pregnant, the fundal height should be between 26 and 30 centimeters. If it's too large or too small, an ultrasound will be ordered to confirm the dates, confirm a single or twin pregnancy, or to detect problems that may contribute to the abnormal growth in the uterus. The fetal heart tones are assessed and counted, and once quickening has occurred, the woman is asked about continued fetal movement, and in the third trimester, fetal kick counts. Her blood pressure is assessed to check for preeclampsia. Her weight gain is monitored and compared to normal weight gain patterns in pregnancy. The urine is dipped for protein to check for preeclampsia and for glucose and ketones for gestational diabetes. Facial and hand edema are assessed, which may indicate preeclampsia. As she gets near term, she is counseled on the signs and symptoms of labor and also questioned about them. Signs of pregnancy that are mainly geared at assessing for preeclampsia and preterm labor. You will learn more about these later on in the semester. These are the initial labs that are usually drawn. If any of these are abnormal, a plan of care will be developed to treat or monitor them. For example, if she is O negative, then she will get RhoGAM at 28 weeks, and also an antibody screen will be drawn in the 27th week. If she is not immune to rubella, she will be offered the rubella immunization in the postpartum period. If she is positive for chlamydia, she and her partner will be treated. Other labs are drawn at subsequent visits. The triple marker or sequential screen, including the maternal AFP, can detect chromosomal abnormalities. The triple marker is made up of the AFP, HCG, and unconjugated estriol. These are labs drawn from the mother. It is only a screening test. Further testing is needed if they are abnormal. If the AFP and estriol are low and the HCG is high, it is suggestive of a chromosomal abnormality. If the AFP is high, it is suggestive of a neural tube defect or abdominal wall defect in the fetus. The AFP is drawn between 16 and 18 weeks gestation. Please read more about this in your textbook. Because gestational diabetes can develop in the second trimester, the mother is given a glucose screen with a 1-hour glucola. If it is greater than 140, then a 3-hour GTT is performed. Refer to your preclinical workup sheets for more diagnostics about the GTT. Be sure that you are familiar with these normal parameters for the pregnant woman. So, what instructions are we going to give to the woman? Well, bathing is okay during pregnancy unless the membranes have ruptured. However, the mother should be instructed to avoid soap on the nipples as it can cause irritation. Douching is not necessary, even though the woman may complain of excessive vaginal discharge. Clothing should be comfortable, and she should wear flat shoes to avoid strain on her back and stumbling due to an altered center of gravity. Regular activity is good, but nothing strenuous or anything that could cause bodily harm. When in a car, she should wear the seatbelt below the uterus and take frequent breaks. Sleeping usually requires support with multiple pillows in the third trimester. She should avoid heavy lifting, nothing greater than 10 pounds. Sexual activity is not medically contraindicated during pregnancy, although they may have to modify positions during the latter parts of pregnancy. Inactive viruses are okay for immunizations during pregnancy, and she should be instructed to contact her healthcare provider before taking any medication. A list of safe medications to take during pregnancy should be provided for her. As a nurse, you should be familiar with the drug categories as it relates to safe medication in pregnancy. The scale ranges from A to D, and X meaning it is prohibited in pregnancy. So think of A as excellent to take during pregnancy, and the other ratings decrease in safety. See the definitions on these slides. The nurse will be monitoring the woman's transition toward maternal-rural adaptation. First, she will seek prenatal care so as to keep her and the baby safe. She will gradually introduce her pregnancy to the important people in her life. She may become closer to her mother as she tries to build and try out her identity as a mother. She will show more interest in other mothers and parenting styles. She will learn to put the baby's needs ahead of her own, as seen when she starts to eat better, avoid alcohol, exercise, and make the sacrifices associated with pregnancy. All these behaviors help her to commit and start bonding to her unborn child. The father also has to get used to the idea of being a parent. It's easier if the mother includes him in all of the changes associated with their pregnancy, like attending prenatal visits, buying baby items, attending showers, etc. The father also has the same need to be recognized in his new role and needs time to create and adapt to it. Grandparents also have to adapt to a new role. If they have been waiting for a long time to become grandparents, they may easily embrace it. However, if they are young and not expecting it, they may take longer to get used to the idea. They may be more excited if it is the first grandchild versus the second or more. They too have to develop their new role as grandparents that is different than a parent. Siblings will accept the baby in different ways depending on their age and personality. Toddlers may not truly understand until after the baby is born and brought home. School-age children can comprehend having a sibling and are usually excited and embrace the big sister or big brother role. They may even attend a sibling class. Adolescents, however, are more unpredictable in their acceptance of a new sibling. Receiving prenatal care is an extremely important thing associated with decreased mortality and morbidity. Women should be encouraged to seek out prenatal care as soon as they think they are pregnant, but that doesn't always happen. They may see it as a perfectly normal thing and be told by others it's not important. They may be unsure if they are going to keep the pregnancy, or perhaps they want to keep it a secret from their partner or their parents. The nurse plays an important role in identifying potential risks and problems and educating the couple about what to expect in pregnancy.